Hey guys, this is Dr. Mahajan from Mahajan Medical Center. Thank you for joining us today in an exciting live broadcast. I'm a internist at in Largo Medical. I'm sorry, in Mahajan Medical Center in Largo, and I'm board certified. And I do once every Thursday a live webcast, and I'm very excited. We have a very prominent psychiatrist, Dr. Nihal Shah, among us today, and he's going to talk about the effect of COVID-19 and how the pandemic and the social isolation is affecting the mental health issues. And as you know, it's a big anxiety situation for a lot of us with our daily routine disrupted, and and a lot of people lost jobs, kids at home from school, and that's disrupting kids routine and the parents routine, and people with mental health, already existing mental health, they are having more difficult time with their mental health, and then more uptick in the suicide, god forbid, if they are on that level, or depression is serious, then we're seeing more uptick there, more domestic violence. So Dr. Nihal Shah, he's a board certified psychiatrist and a good friend. He's right here in Largo and 1100 Clearwater Largo Road. So he has been in the community for 20 plus years. He is a senior partner with Florida Behavior Medicine, and he's at faculty, and he teaches the local residents, psychiatry residents in psychiatry training program at Largo Medical Center. He's also not only on staff at Largo Medical Center, he's also on staff at Winmore, and he's doing a phenomenal job with the residency program and training the new generation of psychiatrists. So without further ado, we'll get Dr. Nihal Shah on our program. And please do comments and give Dr. Shah and me some love, and give us some wows, and give us some thumbs up so we can start an exciting program today.
Okay. Well, thank you very much.
All right, Nihal, you're on our podcast now. So,
okay. But first of all, I would say, let me take the moment to say thank you very much, Dr. Mahajan, for inviting me for this, talk. And it's been a thing that we can do it for the community also. So thank you for what you do for the community as a physician. And so I will take the opportunity for that.
So before we go any further, tell us about yourself.
Yes. So I moved here in 2003. I did my training. I spent 7 years in Nashville, partly at the Vanderbilt and partly Mahajan Medical School and VA system. I always wanted to be, play a lot of tennis, and that was one of my reasons to come to Sunshine State. And ever since then, I never looked back. I really had a good time. I have a very small family, one son, one wife. My son is 17 years old. He's a senior. He's going to be a senior this year. And, we are very, we are close enough friends and family here. And really, I'm enjoying the practice. And now lately, for the last at least 10 plus years, I would say, Dr. Patel being the faculty director and on the program. So we also got an opportunity to be a part of the faculty because of him. And so we serve the residents as well, which is really a great thing to do here, as the need is exponentially high in the community. So I'm really fortunate to have that opportunity as well.
Great. Tell me, how the COVID-19 is affecting, your practice style. Have you become more telehealth dependent? What's happening with your practice?
But Martin, that's really a core question. Ever since we got hit by this pandemic, we always, we've been seeing patients over, 20 plus years and develop the, relationship and the bonding. And with the pandemic going on, there is a significant, increase in the levels of anxiety, the depression, the mood disorders, substance abuse disorders, and also our patients that they are so used to come, like once a month, every 2 months, 3 months, and now with the pandemic, they couldn't come to the office. So a lot of the patients they feel kind of scared to come in the office. At the same time, there is also a significant amount, like a number of patients who really feel relieved that there's a telemedicine going on, that you can able to serve the patients because of that. So I see kind of a mixed impression, but overall, I would say that we are fortunate to able to serve the patients. Uh, it affected everybody. It's a global pandemic across all races, all ages. Everybody got affected by the pandemic. So the impact is humongous. It's kind of hard to sort of measure at this point, but I would say that in this field of uh, medicine and in the psychiatry, there's a significant burden and what treating these patients, and also not to mention about all you guys do as a frontline health workers, treating patients in the ER, in the hospitals, and taking care, taking the toll and the risk of contracting COVID. So overall, I would say that there is a significant burden. We are seeing a spike in numbers in our state. Um, so the practice has been affected in a way that it is, as we feel distant in a ways with the patients physically. At the same time, we feel that we can able to serve them the best we can, and we will just navigate our practice one day at a time.
All right. So tell me, Nihal, that let's let's get you there. All right. So tell me uh, how I know Medicare is paying for the telehealth. Right now for psychiatry, psychologist, and social worker. Is that a effective means in terms of seeing a patient, or you feel that you're able to just do better with face-to-face interaction?
Well, and, I'm kind of an old-fashioned guy. And typically I always enjoyed, the patients also enjoyed that, the physical proximity with with the physicians. So from that standpoint, I do miss them. But on the other hand, like I told you before, that we do feel, a privilege that we can serve the patients. As far as the insurance and the reimbursement, the Medicare, as far as I know, they have been able to maintain, the same level of compensation that we had been getting probably until July, maybe August. And now we are changing a shift in the patients in terms of how they want to continue the services. They really want to continue the telemedicine at this point because number one, they are really a lot of our patients have anxiety issues, and so they don't really feel comfortable coming in office, if they don't have to. So this way they can get their treatment without being exposed, and I think that's a good thing. But we have to just go one day at a time and see what's going to happen after August. Right now, Medicare, we just found out, we just talked to our office and found out that yes, we can able to continue provide the services till August. And
August.
after that, we don't know what's going to be, and that's going to be a big challenge for us and for the patients too.
Sure.
Because it's a practice, a lot of providers, we see anywhere from on a given day, we see about at least 200 plus patients between all the providers and therapists. So to control to maintain the social distancing as well as providing care in a timely fashion, I think it's going to be a challenge.
Okay.
But we'll start with that.
Yeah. So tell us, what symptoms you're seeing more since the COVID-19 in terms of more anxiety, more depression. What you're seeing in your general population, what you're hearing from your colleagues and social workers and psychologists, what's coming in the daily routine.
Well, that's a great question. I mean, that is what we do on a daily basis, is to treat those patients. Interestingly enough, the patients who had underlying psychosis or like schizophrenia and all that, they are amazingly do better in time of crisis. There is where, so there is not a lot of, there is not a significant increase in those ER visits or, inpatient treatments as well. But as far as patients with underlying, mood disorders, anxiety disorders, substance abuse, there's a spike. I mean, there is a significant spike in the symptoms for a variety of reasons. Now they already have an existing condition, and now there is already a socioeconomic depression, financial depression, there is a family issues. There's a change in the whole paradigm in terms of what they have been doing and coping, and now how they have to cope. The other factor is that there was a study done by a psychologist that, in terms of crisis, there was actually, I think, from the Columbia University, and it was a really great study. And what he studied was an interesting thing, saying that if you study patients about how they react to the crisis situation, how do they, react to that, and about 2/3 of the patients will follow the path of resiliency. Like they are like resilient. They will try to cope. They will have less symptoms, and 25% of the patients will have some moderate symptoms where they will need the treatment. And I would say about 10% of the patients will have a lot more worsening in the symptoms. Now this is the population that we studied, and people with underlying like this issues together, as opposed to mood disorders, alcohol, substance abuse, anxiety, there is already a doubling of the cases. So again, what I see in my practice, that patients have hard time functioning with those who have been stable before. We see a lot more, inpatient visits to the patients coming in the hospitals lately. At least I can tell about the Win more because that's where I go. Patients need a lot more assistance and other ways of coping skills, because so far what they've been getting, what you call it, the traditional treatment, medications and therapy, simply is not enough. So again, the anxiety is a predominant symptom that we see in some patients. And to cope with the anxiety, they often manifest other symptoms concurrent with the anxiety, like depression and substance abuse too. So the whole, paradigm is now shifting from one condition struggling with, as a complex condition that we all have to work with. And that has been changing. I mean, as we see that in the beginning, if you see the pandemic, how we, navigate through this couple of, for the past few months, in the very beginning, March, April, when we start seeing cases here, people get into a panic mode and, anxiety, and obviously a lot of the local businesses, schools often reacted and they closed the schools and all that. And now I see that at some point it's like a shock and absorption effect. You create something shocking, it kind of steers the whole thing, shakes the system, and then later on it kind of slowly people try to adapt, accept, acknowledge, work through. So that is what I see, Dr. Mahajan, that patients are, on one hand, are struggling with the anxiety. On the other hand, they are beginning to accept that this is what they have to do, and and that's what we try to, treat our patients with. That we have to navigate one day at a time, and hoping that the pandemic, the curve will flatten down at some point.
That's a great answer. We put a link for CDC, for the effect of pandemic on our today's webcast. I'll encourage everyone to, look at that, and it does give a lot of great tools in addition to what you were just saying. There are a lot of patients who are struggling with having difficulty sleeping, having more stress and more domestic violence. We have RCS CEO, and he deals with women's shelter, and he was telling us in our local community there's a lot of uptick in domestic violence, and so all those are related to the stress of the change in routine, losing jobs, stress of unknown. In your experience, what are the various strategies you and your team recommend to your patients? Medications, non-medications, counseling. So walk us through if someone who is dealing with anxiety and stress because of COVID-19, what is your strategy right now?
That's a great question, Mahajan. In fact, I really want to talk about those more than actually, because obviously we know this is going on, multiple complexity of issues that today's patient is, dealing with, more than just they have been dealing with in the past. Uh, the coping skills, as a MD physician, we always talk about medications and, psychopharmacology interventions and so forth. And obviously, there's a huge amount of research and explosions and medications development happening every couple of years. We got new product, we got new medicines out there. But what we are missing is that it is not just a medication that can fix the neurons and receptors and patients can start feeling better. It is more than that. And I think that being my, with my, upbringing and some exposure to some other alternative ways of dealing with stress like yoga. I'm not a big yoga, a guy, but I've been trying to practice for the past 7 years to help, and some way of breathing, which I'm sure you are also. I've seen your videos, and you know a lot about this, and just a coping skills in generally. How my answer, my treatment based on three fundamental things that I try to work on each patient. Even though I spend less amount of time, I want to make sure that they are hopeful. And hope is a very powerful feeling, Dr. Mahajan. And hope, it can generate hope, HOPE, right? You can generate through hard work, okay? You have a passion for life, you have to put some energy, and you have to be, basically to be hopeful is a good thing. And that will be, that will bring you a feeling that you can cope better with this condition. And in any condition, whether it's dealing with a cancer or so dealing with this chronic conditions, depression, once you know that you can cope better, and once you're hopeful, then obviously your body reacts in a positive way, and each day becomes more meaningful for you and the family. So hope is the most powerful thing. Second important part that obviously we refer patients to, like traditional counseling, cognitive behavioral therapy, if they have underlying, crisis of any kind, whether they encounter violence of any kind because of this current crisis or losses, refer to grief therapy, refer to trauma therapy, cognitive behavioral therapy. All those therapies are being set, they're all being set and they have been well designed. What I think that each patient can able to, they have the unique circumstances. And right now, with the global lockdown, this is not something, in crises like hurricanes and tsunamis or storms or any kind of fire, those crises come and go so quick. This is so sweeping to the entire country and the world, okay, and also very insidious, and nobody knows when it's going to end. So that brings a very unique perspective to each mind that where am I standing? What's going to happen? What's going to happen to my family, my kids? How am I going to deal about this? What's going to happen to my finances, my job, my health, access to services? And it affects each segment differently. So let's talk about, I would say, talk about the adult, because I normally deal with adults. We do have, child psychiatrist, Dr. Mayer, Dr. Augustinus. They are really doing extremely, a great job serving kids and minors. But I'm dealing with adults, me, Dr. Patel, and other colleagues with us, that and the family, in the geriatric population. So each has different needs. What I've seen before pandemic, people who are having loneliness, depression, anxiety, and younger people, they have a lot more symptoms. They have a hard time dealing with these conditions. There was a different time when the old people, the geriatric population, I would say that, they used to cope better. They would accept things because they had learned through life experiences that, how to work through it. But now, with the pandemic, that curve also been altering. Now they are actually having hard time accepting and working through it, partly because they are losing their colleagues, friends, family members of their own age group. Okay, so they have hard time coping with that too. So now the curves are actually what we used to see, and now the paradigm is again shifting. And so each segment of population challenges, they represent different challenges. So I work with the families and I work with the patients and I try to learn their unique circumstances. And I said, look, we have to, besides the policies aside, like whether you will put the mask yes or no, or following this and that based on what your belief systems are, look about the evidence-based medicine, follow as a physician's recommendation. And if that's the case, you're going to follow the social distancing, you're going to follow mostly the quarantine, the best, not quarantine I would say, but at least some form of quarantine and isolation. And of course the hand washing. So think about the scenario when you're going to present that. And if that's the case, how are you going to deal about it? You're going to feel the same monotonous routine every day. One of the things that people lose, charm in life because they think life is so monotonous, and it depends how we look at it. So try to, within what you have, your given circumstances, try to make your life look as we can do certain things, small little things that can make a difference, that can serve some purpose in life for you and your family and your friends. And there will be many things that come across. If you don't have a good physical health, so be it, fine. Look at the old pictures, okay? Start recalling stories, writing it down. And you will see that the journey that you do with your mind will take you back when you were 20, 30 years old and make you feel better about it. Again, that better feelings is going to help you to relax, to navigate your day in a better way, and to cope it better. And, when you think about, one of the main trigger for the anxiety is the uncertainty, right? What's going to happen? How's the pandemic going to end? And we tell patients that look, we all are in this together. We all have the same issues that we are going to cope with that. So let us just try things that we have in control on, not to think about the things that we don't have any control on, and live one day at a time. It's like the saying, what we commonly say, people with AA meetings and AA meetings, the 12 steps is one day at a time. You pass your one day and make it better. Obviously, you as a physician, I'm sure you always emphasize patients with exercise and healthy eating and diet, and we always do the same thing. We reinforce what you say: healthy eating, diet. But diet is one of the things that I tell patients now. You require to have more discipline, because now you're staying home, you're working from home, you have access to your food 24/7. So one of the things that I strongly recommend to our patients who are struggling with the physical health, the weights and all that, and of course those are affecting the mental health, because if they gain weight, they will have low self-esteem, they get tired, they can't focus, they can't concentrate. So every physical symptoms have an interlinked or interconnected with the psychological or mental health symptoms. They both are interlinked strongly. So I tell them that try to look your day and design your day in a way that you use your calories or food and you try to get maximum things out of it. So make your day productive in the mornings. Also, one of the things that, there's an opinion about the video games in the kids, I tell them. But I think it is a great tool nowadays for a lot of the youngsters, minors, who can able to, play the video games. It actually helps, spiritual, connections, and, it actually helps developing some skills, neurocognitive skills as well. A lot of the teenagers, I heard that there are some video games that they can talk with the kids and can able to play, and so they can able to socialize that way. So there's a great tool that they can use it. In fact, there's studies shown that you can spend 4 to 5 hours a day and it doesn't have any detrimental effect. So again, there's also a good thing that you can do. Other thing is look around you, the nature. There's so much to look into it and feel good about it. You don't have to go to park or gardens or beach if there is a potential risk of crowding and exposing risk of pandemic. You can just look around, and one of my colleagues is big into nature, and he posts every now and then butterflies and small animals and stuff. And I said, this is a great thing. You can look small little things in life and feel good about it. You try to do some, plant some, vegetables, some plants, some, gardening, a little bit of that. It's not an expensive hobby at all, but do a little bit of those if you can. Again, spend time. So coping skills are very important nowadays than it was ever before, because you know what? We don't know how long we're going to last this, how long this pandemic is going to last. We thought that they're going to be flattened by July, and we'll open it up. And sure enough, now we know the scenario is looking even grimmer than it was before. So, coping skills in most ways, I think every patient can do a couple of things as far as coping sort of margin. Number one is they can look at their resources, what you have, and find something within what they have so that they can make their life and the family life effective. And I think one of the things is many things for people to play some board games, crafting, coloring, developing some, learn some new hobbies. There's a lot of online tools out there for free that they can learn music. So all those things are important. Okay.
Okay. So if I understand you correctly, I know you covered a lot of ground here. So let me try to summarize and make it a little bit more bullet points, what you said, so people can digest it better. So number one is know what to do if you're sick or concerned about COVID-19, if we're dealing with just COVID-19. So in other words, if you're sick, there's no point sitting on it. You should contact your healthcare professional and get tested. Number two, know where and how to get treatment. Again, telehealth visits, and go to your, local community health departments to get tested or, get reassurance if you don't have it. Number three, take care of your emotional health, and you went at length on that. Take care of your emotional health and your family's emotional health. And then take a break from watching media, because I think, as you alluded to earlier, too much media is causing a lot of anxiety if it's happening in your backyard, or you seeing the pictures of the hospitals in New York and the cold mobile storage unit with morgue and all that. So yes, there is mortality, there is all that, but you got to, as you said, live in the present. So you should not consume more than 20-25 minutes of media a day, whether it's social media or news coverage. Fourth, you emphasize take care of your body, whether it's daily exercise or eating better, like you were saying, as you're emphasizing that they have more access to food, so there's more need for discipline for eating better. And then sleeping is important too, like at least get 8 hours of good night's sleep, and I think next day you're brand new. So that's critical. And then avoid any excess alcohol, because now you're at home and you get all your, wines and whiskeys and sodas available. So you don't want to be doing that, because that can cause more depression and more anxiety. And take time to unwind, as you were alluding to, coloring and hobbies and whatever makes your, emotions and juices going. And then connect with Mother Nature. I think that's a great point you brought up. A lot of good data on, go for 7 days and disconnect from the all the electronics and go camping or hiking. You can reset your biological clock and sleep better and help you with the anxiety. So that was a great advice. And the last piece is connect with the community. So do talk to your neighbors on phone or FaceTime. Talk to your families with FaceTime, Zoom. Or if you're a faith-based person, Zoom your church or temple or whatever is your faith base, and do continue those practices. Did I miss anything you were covering, Dr. Shah?
I think, the substance abuse part that I actually really missed. Yeah, I think that's really, pretty much everything. And of course, the frontliners are important too. The doctors and nurses that they come in and they often need to make sure there's a case that, if you remember, one of the ER doctor in New York who, passed away because she was gone, and then she again wanted to come in, and despite the fact that she was told not to come back because she needed to take care of herself. So that brings the point that even in that we have to take care of ourselves so that we can take care of everybody else as well. So that is an important point for healthcare providers, frontliners, that brings the same thing, taking enough sleep, rest, talking to colleagues. And a lot of times doctors don't, or the healthcare professionals, they don't talk. They feel like they can go on and on forever. But we all are human beings. We all have our own weaknesses. and at times we get burnout. We talk to our so please talk to our friends, family, spouses about how you feel. Sometimes sharing, it really helps. The other part is the empathy. Has a lot of good data, Dr. Mahajan, that empathy helps changing social behaviors. Um, for example, people who are more empathetic, they often tend to follow, like social distancing, putting mask on, hand washing, all the above. People who don't, they really don't care, and that affects everybody else as well. So changing empathy, those behaviors can be changed, managed, but what is happening now that the paradigm has been shifting every month by month. So these behaviors are also changing now. People are more relaxed. Probably don't care than they used to back in like 2 months ago. So again, that has sort of negative or consequences in terms of controlling the curve down. So yeah, I mean, it's very important part that you shared, and obviously talking to the friends, family, using all the social media, Zoom is very, very important. We have developed a group that at least two groups that I normally do a week with close friends, that we talk about certain spiritual things. Also, we talk about just sharing the data, and sharing the knowledge and understanding, and the condition, what's going on. So you feel good about it. So it's very important. Obviously, sharing with your family and friends also is very helpful. So, Dr. Mahajan, I think you covered everything well. I was just going all around. As a psychiatrist, we are always overly elaborative and not to the hit points. I mean, but I'm trying to get you as a physician, as an internist, you hit the bullet points. So that's a
No,
good
no,
keeping.
we need good psychiatrists. Otherwise, we're gonna have a lot of cuckoos running around. So that's very important to have good psychiatrists like you in the community. We have a lot of folks joined, so let me acknowledge them. We have Mr. Gupta joined us. We got Neetu Mittal joined us. Rosemary Eller joined us. Jackie, nurse practitioner, joined us. Patricia Wright is with us on the podcast. Andrea Serdo and Dharti Patel, our social worker from On Plant, joined us. Marianne Spearman joined us. Jen joined us. John Wesemer has joined us. So I appreciate all of you guys, pitching in and listening to Dr. Shah. I know, Dr. Shah, you are, practicing yoga for the last 7, 8 years. So I do every podcast, a breathing technique, which I teach my audiences here, and they've been practicing with me for last 2, 3 months. So we're going to do a alternate nostril routine, or Nadi Shodhana, with them today, and I'm going to teach them two variations. So the people who've been doing it with us on a long time, I'm going to teach them a newer, higher version. But uh, other than that, let's pick your brain. What do you think they should be doing in terms of pranayama or breathing exercise? Give me two which comes to your mind other than alternate nostril,
So
which
because,
which I'll do.
right. So I think I think what you did, I saw was the Kapalabhati, and that breathing. I'm not big into names, but the other two that we also try to practice with our teacher now was abdominal breathing. And because our diaphragm is also has to be it has to be strong, and it actually has been utilized in the breathing. So I can show you. I don't know how to, but Dr. Mohan, is there any way that I can focus that part, or I don't know whether you
So you
can do
can
it? But
you can just describe it. Let's just do it that way.
okay, so basically you have to breathe in and out fast, making sure that your abdominal muscles are moving in and out. So that's where you're raising your diaphragm up. That's number one. The other breathing is that you can that also do is called intermittent breathing, where you try to inhale on a three levels. So basically, what you are doing is normal inspiration, exhalation, and then what you do is you inhale. And our lung has three different lobes, like three parts. So basically, try to as if you think that you are feeling your upper lobe, your lower lobe, or middle lobe kind of thing, and the lower lobe. So But the whole concept is you inhale intermittently. You inhale for a brief pause, again inhale, brief pause, again inhale. So you extend your inhalation and then you exhale at the same time. So that is one of the things you can do. The other part is also what we try to practice because a lot of people are now working from home, sitting in chair for long hours. Obviously, our spine backs are affected and our necks affected. We assume normally in odd postures when we write or read, in front of computers. So to practice our postures are also important so that our back is more aligned. Our back pain, hopefully you never get back pain if you get the right practice of assuming the right posture. So those things, I kind of practice small little things that can help, and that really helps me a lot, to be honest with you. And even with my meniscus injury that I have sustained through tennis, I can still play tennis, and I can do everything that I can. So really, those practices helps. I can, I'm not here to perform any yoga postures, but if you look at it online, Google's, and there's something called Tadasana, which is a posture how you start, stand correctly with the back straight, shoulders back, your quads activated, and putting pressure evenly on your foot can help. So basically, understand the body as to how we can feel lighter when you stand up, and if that's if that's the way we feel, then you can stay that way, and you can feel lighter, and you are in peace. You are physically and mentally you are in harmony, and that is important way to feel that way. Positive feelings helps to cope better. So I think that being said, I think Dr. Mahajan, that's what I have to say about the yoga. Obviously, I'm not here to perform those things,
No, no,
but if
no.
you want, I can show a few. Yeah.
No, but that's a good point you bring. Everyone has to have a good teacher. We just give them suggestions. You can't teach them yoga, proper posture, or proper pranayama. We can just say, that it's very helpful, and you've been practicing it. I've been practicing it, and we know from our personal experience
Right.
that it is useful. So yeah, they need to explore more with having a teacher. You have a teacher for 7 8 years, and it's very important to have a good teacher. Isn't there a yoga teacher organization in Tampa Bay, and they can Google that and they can find a good
Yes,
teacher?
absolutely, absolutely. Yes, yes. There's a lot of, yeah. And
So go ahead.
the other thing I want to talk about really quick is the thoughts about the boredom. I forget to mention that, Imagine, because our life that we live here is everything is so fast paced, over information overload. Everywhere you go, social media, phones, computer calls, everything. So our mind is sort of constantly receiving signals from all directions, and sometimes it gets stressful at some point. No matter how you know I mean, how good you are, or how you could want to be, at some point our brain get overstimulated. And it's important to realize that. And so in this current times, it's okay to just get your brain, trying to stay a few minutes away from, like you already mentioned on social media, I would say stay away from every gadget that you have, phone, computer, TV, and just find 5 minutes. And you may feel frustrated, you may feel like 5 minutes looks like a 5 hours to you, but obviously it's going to give a benefit. You will feel your body and your nerves getting calmer at the end of the 5 minutes. I tried every now and I do try those things, and it was very difficult in the beginning, but at the end I feel a lot more. I feel like rejuvenated physically and mentally. So it's really good to practice those. Boredom is not bad. Sometimes it's good for your brain and for your physical health and your mental health. So just don't think that boredom is. My son was saying that, Doc, Daddy, if I don't do this, I get bored. I said, no, it's okay. Just bore down, and you feel good about it.
I
You feel
think
integrated.
you hit a good point there, Nihal. Quietness and calmness and not doing anything is a art, and we are losing it. We need to You need to go back and learn it again, because that does help to recenter the brain, and that's the key about calm brain, and you make better decisions. You're not with everything, with relationships, with what you say, with food choices, with everyday living. you get better if you have calmer brain. So just cutting back all the media, as you said, and 5 minutes, 10 minutes of quiet time and just focusing on your breathing will help you big time. So uh, any final word of wisdom, Nihal, before we do our
Well,
closing?
wisdom, no, I would just say that, it really helps me as a psychiatrist is I try to make a little things as a surprise each day. I try to do that, and that makes my day and, people around me day better. Give a smile to your loved ones. Tell them that you love them, that you care about them, and that always gives you back. They actually give you back in terms of how much they love you and care about you. And that really brings as a family bond, as a community being stronger, family being stronger. So that really helps a lot for all the ways. Positive energy, healing, sharing, talking everybody and communicating. So make a little surprise and smile and tell them that I love you guys, I care about you, and show the empathy, and that carries long ways.
I think that's a great advice. I typically get up in the morning and I say good morning to my both boys, and even if they don't want to hug me, I just give them a beer hug. I start my day that way. And it's good practice for me, not for them, but for me. And I think you lead by example. They see that. Hopefully, they will do that to their loved ones too. And then, when you go home, I always yell at them and have them come downstairs, even if they don't want to. Boys are boys. I give them a hug, and I think it gives me more peace than maybe them. And I'm pretty sure it helps them too to know that someone loves them. So that's very important to have that empathy and connection with your loved one. So if you want to stay with me, we're going to turn some music and you can do some Nadi Shodhana and alternate nostril breathing with me. How about that?
Okay.
Okay, let me turn on the music. All right, guys. So can you hear the music? Give me a thumbs up if you can hear the music. I want to
Yeah.
see some thumbs up, some love, so we can start some alternate nostril breathing with Dr. Shah. He's going to do with us, and that will be an honor because he has been practicing yoga for a long time. So it's a good thing to see me just not saying it, someone else also saying the benefits. Um, Alternate nostril breathing is one of the simple technique which you can do if you're feeling anxious. It helps you calm down your brain using your left and right side of the brain, and you center the brain better. And also it's also called Nadi Shodhana, which in English mean you're clearing up your circulation, your channels. And you can do that before you go into meditation. You can in fact do the diaphragmatic breathing, what we taught you earlier and Dr. Shah alluded to, before you go into meditation. Any of the breathing techniques you can do before you go into meditation will help you calm your brain and get more effective meditation. Um, and the blood pressure, as I alluded to earlier in my previous webcast, there's good data that if you do breathing exercises regularly, you can control your sympathetic and your parasympathetic system, your autonomic nervous system. You can regulate it better with breathing exercises. So more you're going to practice. It's not an overnight thing. You didn't get here overnight. With the anxiety, with the blood pressure, you're not going to get better overnight. So you got to practice it. So just don't give it for 5 minutes and say nothing happened. You won't see anything. But you do it for 3 months, I promise you, you will get off all that Xanax Dr. Shah prescribed, but he doesn't prescribe as much. All right. So what's alternate nostril breathing? So it's very simple. What you do is you put your left hand on your thigh. So we're going to teach you two variation. One for the beginners, which doing it for first time. One for the advanced practitioners who's been doing with me for last 2-3 months. So let's do the beginning one. So the beginning one is very simple. You put your right thumb on your right nostril, and then these two fingers goes up here, and your ring finger is for blocking the other nostril, but keep it out right now. And then you breathe out through your left nostril, and then breathe in, and then close that nostril gently, and then breathe out through your right nostril, and then breathe in through your right nostril, and then close it and breathe out through your left nostril, and then breathe in through your left nostril, close the left nostril, breathe out through your right nostril, breathe in through your right nostril, close it gently with your thumb, breathe out through your left nostril, breathe in through your left nostril, close the nostril, breathe out through your right nostril, breathe in through your right nostril, close the right nostril with your thumb, breathe out through your left nostril. So that's a cycle of 5, which is good to start out with. And that's for people who are new to this technique. That's a simple way. In fact, a much more simpler way, if you're having tough time with your left and right, is just to close your right nostril and breathe through your left nostril in and out. That's the simplest way, but that will help you with reducing your anxiety. Keep your eyes closed when you're doing it, and keep your focus on your breathing in and out, so that way you can know whether it's right or left. And the simple rule of thumb when you're doing the right and left system is, anytime you inhale, you close that nostril. So if you're inhaling through your left, you close it, and then you exhale, and then you inhale through your right nostril. So anytime you inhale, you close that nostril. So that make you remember it easy which nostril you're closing. Inhale and close. That's simple rule. So let's show you a variation which is a little bit advanced, but not that hard. So the concept here is you're holding it when you breathe in, and you hold both sides. So it's like you breathe in, and then you breathe out, and you block it. So in that concept, you are holding the breath for 1, 2, 3, 4, 5, a count of 5. So in that concept, you're just pushing your breathing in and out, and you're holding it for a count of 5. So it's a little bit advanced. I'll show you 3 times, and it's not that difficult, but it's just, if you have hard time, you can just do the first variation, which I just taught you earlier. So let's do the when you hold it in between and block the both nostrils. So same concept. So you breathe in, put these 2 fingers on your middle, and keep your left hand, the ring finger ready. So you breathe in through your left nostril, and then you block, and then you block both nostrils at the time. Count till 5. 1, 2, 3, 4, 5. And then you open your right nostril and breathe out. And then count till 5 here too at the end of the exhalation. 1, 2, 3, 4, 5. And then breathe in. And then block your both nostrils and count till 5. 1, 2, 3, 4, 5. And then breathe out. And then count till 5 at the end of the exhalation. 1, 2, 3, 4, 5, and breathe in. And then block both nostrils for count of 5. 1, 2, 3, 4, 5, and then breathe out. Keep it there at 1, 2, 3, 4, 5, and breathe in. And block both nostrils. and count till 5. 1, 2, 3, 4, 5, and then breathe out and count till 5. 1, 2, 3, 4, 5. So that's it. Wasn't that hard? Uh, we appreciate Dr. Shah doing the alternate nostril breathing with us. I think it's a fantastic tool, simple tool. There's another tool I taught my folks earlier, and I'll share with Dr. Shah. Maybe he does that with his patient. It's like what he was saying, giving hug. What you do is you're giving hug to, let me go on full screen so it's easy. So it's like you're giving hug to yourself, and then you gently rub back and forth. If you have your loved one with you, they can do it if you're anxious, or you can do it yourself if by yourself, and rub back and forth like you're giving yourself a hug. And there is some data that it produces oxytocin and help you relax and calm you down. Let's get Dr. Shah back. So that's another simple technique you guys can practice if you are in real meltdown and overwhelmed with whatever it is, whether financial or health, or your loved one got COVID, or whatever it is. You're giving yourself a hug. With that, we appreciate Dr. Shah joining us today. Thank you so much, Dr. Shah. And you guys, if you guys need a good psychiatrist, he's down the road on Clearwater Largo Road, and he's very kind to all our patients, which we have sent over the years for their mental health needs. Dr. Shah and his team has always done a fabulous job. Thank you, Dr. Shah, and stay safe.
Thank you, Mahajan, for your time and for getting me invited here. Thank you very much. All the best for everybody.
Yes.
And be safe.
Yes. All right, guys. So we to the end of our broadcast, and we have a very exciting guest coming on our next podcast. Is a transplant surgeon. He's the first guy who did the cardiac transplant surgery at Largo Medical Center. And I'm very excited to have the cardiothoracic surgeon from the transplant center come to our next podcast. He's going to demystify the cardiac transplant, how it's done, and what are the indications, and what's the success rate of the only Pinellas County transplant program. So that's going to be very exciting, and we're going to take a break from COVID. I think we all deserve that break. Thank you so much. Please give us love. Please do give us comments. Give us some wows. Give some comments to Dr. Shah if you have questions for him. General question. We don't want any HIPAA violation, anyone asking specific question, but general questions for him, I can pass it on to him, or if I can answer, I'll answer them. But keep doing the breathing exercise. As Dr. Shah pointed out, he does it himself, and there is a lot of good scientific data behind it. With that, we come to the end. Be nice to yourself, to your fellow human beings, to your family, to the biosphere, and Mother Nature. Namaste.